Hello, my name is Dr. Jagdish Shinde, and in my today's video, I am going to tell you about what is recurrence of cancer and how to prevent the recurrence of cancer. Before starting the video, I just want to tell you the patients who want to do personal consultation with me, I have given a sub link in the description as well as in the comment box for doing online consultation. You can avail my personal consultation by clicking on the link. So starting with the video, so what is recurrence of cancer and how we can prevent recurrence of cancer? So whenever any patient is diagnosed with cancer and he undergoes all the treatments including radiation, chemo or surgery, and he is on follow-up, sometimes it happens that the disease might recur or disease might come back and patient gets symptoms of recurrence of cancer. So in this video I will tell you how to prevent recurrence of the disease. So the number one cause which causes the recurrence of cancer or which increases the chances of recurrence is the stage of the disease. So it is very important for the patient to detect the cancer in very early stage. So stage 1 cancer patient has very less chances of recurrence, while the stage 4 cancer has very high chances of recurrence. So as stage of the cancer advances at the time of diagnosis, the chances that patient will have recurrence increases. Simply, we have to detect the cancer in early stage in order to prevent the recurrence of the disease. So if you have any cancer related symptoms, then it is very important that you should consult your physician or a doctor to detect cancer in early stage. The second thing is that the treatment. So whenever any patient get diagnosed with cancer, then it is very important to take a proper treatment. If you undergo a proper treatment according to the stage and site of the disease, then it is very likely that you will get a good survival and good chance of cure. So the treatment will decide the chances of if the patient don't get proper treatment, then there are chances that patient might have recurrence. So this is the second thing to prevent recurrence. The third thing is follow-up. So any patient has completed his planned treatment of either radiation or surgery or chemotherapy, then after completing the treatment, the doctor will suggest you a follow-up. Means after completing treatment, patient has visited doctor around 2 or 3 months depending on the stage and site of the disease. At that time, doctor might suggest you some tests like PET-CT scan, CT scan, MRI scan or some blood test. So at that time, you need to do that particular blood test or investigations and make sure that cancer has not came back or there is no recurrence of the disease. So this regular follow-up is very important, and not a single follow-up is enough. You need a follow-up for a long time, might be a lifetime follow-up is needed. So you have to have regular follow-up with your oncologist doctor after completing your whole treatment. And in case the recurrence is detected, we need to detect the recurrence in early stage and we can treat the recurrence with curative intent if possible. The next thing for preventing the recurrence is lifestyle changes. So if patient has any habits like tobacco, alcohol or smoking before developing the cancer, it is very important to abstain from these habits to prevent recurrence. If patient has these habits of continuing the tobacco and alcoholism and smoking after completing the treatment, there are high chances that patient might recur with the disease. So it is very important to prevent these habits after completing the treatment. The next thing is you have to maintain very good lifestyle and diet. So if you are not doing regular exercise, then again there are more chances of recurrence. If you are not maintaining proper diet, then you might not maintain your good health and there are more chances of recurrence. So you need to maintain proper lifestyle including diet and exercise to prevent recurrence of the cancer. So these are the all things you need to do to prevent recurrence of the cancer. So if you want to consult with me, you can consult with me regarding any cancer treatment. I have given link for consultation. Thank you very much.